So with narcolepsy and idiopathic hypersomnia, there are some non-medication interventions that can be beneficial in improving restorative sleep, decreasing daytime sedation. So the first one, of course, because it applies to everything pretty much, is sleep hygiene. But what's a little different is if someone has narcolepsy, regularly scheduled naps can be really helpful. So having kind of brief naps throughout the day can actually help maintain wakefulness during non-napping hours. This doesn't tend to be as helpful in individuals who have idiopathic hypersomnia. It's also really important to try to maintain a regular sleep schedule. So going to bed and waking up at similar times every day, that can really help create that structure to assist in wakefulness during the day. And allowing for appropriate accommodations that are reasonable for people who experience hypersomnia. Sometimes that is allowing for naps or allowing people to get up and move around the room a bit more so that they can maintain wakefulness better, and just having a little bit of flexibility on days where they may be more symptomatic than others. From a medication perspective, when we look at narcolepsy, there is strong evidence for benefit in modafinil, which is a stimulant, as well as a couple of other agents that are pretty specific to these kinds of symptoms. So pitolisant, oxybate salts or sodium oxybate, and solriamfetol. Slightly less data available, but are sometimes used, include armodafinil, dextroamphetamine, and methylphenidate products. And then for idiopathic hypersomnia, the drug of choice is modafinil. There are some data to support benefits with clarithromycin, interestingly, methylphenidate, pitolisant, and sodium oxybate or oxybate salts. Now, it's important to know that idiopathic hypersomnia can often be treated fairly well with a singular agent, but with individuals with narcolepsy, they're often on a couple different products. And when we look at stimulants, a lot of times those doses of stimulants like methylphenidate, dextroamphetamine, if they're taking it for narcolepsy, may be higher doses than you would be used to seeing for other indications such as ADHD. When we look at the guidelines and the comparisons of interventions, one of the key ones that I want to kind of hone in on are the products that are appropriate for treatment of cataplexy symptoms. So if someone has narcolepsy type 1, they should be offered one of these three products, right? So oxybate salts and pitolisant. Dextroamphetamine we don't really reach for first because, again, it's not one of the initial therapies, but that one does have some support in treatment of cataplexy symptoms in narcolepsy type 1. When we go through the other products, modafinil appropriate for all three, I should say. Pitolisant can be used for all three indications. It doesn't tend to decrease severity of idiopathic hypersomnia as much as it does for narcolepsy. Oxybate salts appropriate for any of the conditions. Solriamfetol is more specific to narcolepsy, so it's more beneficial. It has a strong benefit in narcolepsy. Modafinil has really data for narcolepsy over idiopathic hypersomnia. Dextroamphetamine, same thing. Narcolepsy over idiopathic hypersomnia. And then methylphenidate improves severity. It's not as beneficial for sleepiness as some of our other products. And then clarithromycin specifically can be beneficial in idiopathic hypersomnia and not so much narcolepsy. So in breaking down the stimulants that we haven't really talked about before, we have our modafinil and our armodafinil. So Provigil and Nuvigil. These are Schedule 4 products, a little different than our Schedule 2 stimulants that are also used for ADHD. Big things with these, they should be taken early in the day. It's important to note that they can interact with oral contraceptives and decrease the effectiveness of those products. And there are some associations with increase in congenital abnormalities. So that's a good counseling point or education point for individuals. But they do tend to be pretty beneficial in improving excessive daytime sleepiness, severity of symptoms, and the quality of life, particularly modafinil. So that's the first product that we're pretty much always going to be reaching for people with excessive daytime sleepiness. Stimulants like amphetamines and methylphenidate have lower quality of evidence and can be a little bit trickier to use because it's Schedule 2. There's additional box warnings and risk for dependence and misuse. But they are sometimes products that we will reach for if modafinil and armodafinil are not beneficial. Some unique products that you don't really run into outside of this space include Sunosi or solriamfetol and Wakix or pitolisant. Solriamfetol is a norepinephrine and dopamine reuptake inhibitor, so a little bit similar to bupropion in that sense, but has specific data supporting its use in this indication. It's also a scheduled product, so it's a Schedule 4 product. Big things, they should not take it if they are going to bed sooner than 9 hours from their last dose. It's usually a once daily dosing product. Now, because of its effects on norepinephrine, it can have some potential for cardiovascular implications. So CVD or high-risk CVD, we should avoid this product, and it can increase anxiety because of how stimulating it is. Now, there is some risk of it for abuse and dependence, but it's fairly low risk. The other product, pitolisant, is approved not just for sleepiness, but also cataplexy, as mentioned before. And this is kind of interesting. It's an inverse agonist of histamine, which is kind of like doesn't really make a lot of sense. So it modulates histamine, right? So it kind of affects histamine in an interesting way, because if we think about antihistamines, right, antihistamines usually induce sleepiness. Kind of interesting. So big things with pitolisant is that it also can impact the effectiveness of oral contraceptives, similar to modafinil and armodafinil, but it's usually pretty well tolerated. Headache is the most common side effect that we tend to see. It does tend to take a bit longer to work than some of our other products. So our short-acting stimulants tend to work pretty darn quickly. People will feel a response to the medication really right away, essentially, because it's very stimulating. With pitolisant, it takes several weeks to really see it effect, so that can be challenging to use. I haven't used a ton of pitolisant like in practice, but I have seen a few people on it. And it, similar to our other products that we've talked about, should be taken early in the day, right? Early in the day, try to maintain that wakefulness throughout the day. Oxybate salts is kind of a unique and interesting product. It's a Schedule 3, and if it's not a salt formulation, so if it's oxybate without the sodium formulation, it actually is a Schedule 1 substance. It's a substance that has historically been used for nefarious purposes because of how sedating it is, okay? So oxybate salts kind of seem counterintuitive in the sense like, oh, well, aren't you excessively sleepy? But the purpose of oxybate salts is to actually promote stage 3 sleep. A lot of times, as I've talked a little bit about, one of the things that they see in polysomnography in these hypersomnolence disorders is low rates of stage 3 or deep restorative sleep. So this helps to promote deep restorative sleep that seems to improve wakefulness throughout the day because people are more refreshed, essentially. Now, this is a product that has a specific associated REMS program, and it's only available through a singular pharmacy source. It can cause respiratory depression, and it is at a risk of abuse and misuse. So it is something that needs to be used with some caution, especially since a lot of the use has to be at bedside, essentially. So there is a formulations that have to have a second dose, not all of them. So Lumryz is 1 dose, but the other formulations, you actually have to take a second dose in the middle of the night, which means you have to have it by your bedside, and there can be some risks with that too. It also is very high in sodium content. Xywav is the lower sodium content product, but those high sodium contents can be challenging people, for example, that have heart failure, right? It does require suspension with water, so it's kind of an interesting product that has very specific use in promoting deep sleep in individuals who experience hypersomnia, whether it's from narcolepsy, and it can improve cataplexy, or from idiopathic hypersomnia.